So I'm Grace. People call me Dr. Sun or Dr. Grace. So my background in dentistry is go way back, maybe similar to Mel's, way back in several decades ago, but comes to laser dentistry. I started laser dentistry in 1997. That was my first laser. And then over the years, of course, we spent at least $250,000 on hardware. And comes to PBM. PBM teach, that's what I do since the late 90s. And I have probably 10 regular surgical lasers and 10 PBNT units. I'm not the only one use it. My staff use it, and they're my best team that I can get, because without them, I would not be able to provide the best service for the patients. So next slide. Let's see, can I advance the slide? Okay, so since I'm providing the we call cold laser, or I call LLLT, to the patient before and then after the treatment when they are in the dental chair, and they know the benefits of it, and usually they will request, can I borrow this to take it home? Of course, you don't want to lend them that unit. So over the years, I've been thinking about, I want to have something they can take home so they can continue provide the service for themselves, give themselves some good energy they need for wound healing, for control the discomfort, and have less post-op discomfort and less swelling, all that. So since COVID-19, I got more time, so I actually put the extra time, developed these two take-home units, and I named them PBM Lite and PBM Lite Plus. But basically, the silver unit comes with a two red light, 630, 660, and one infrared at 850. The blue unit comes with two infrared light. So that's 660 at the red light range, and 850 and 940 nanometers. Okay, next slide. So it comes in a pouch, and later I will show you the whole package. And both units are excellent for them to take home. So they're a little different, they're different price range. And the silver units, it's entry level, and actually it's excellent for if you want to focus on soft tissue applications. And the blue unit, and since the infrared, we have two infrared dial, so that can penetrate a little bit to deeper tissue, then that's very good for lymphatic drainage. It's very good for acupuncture points, and it's very good for like neuropathy and or bone treatment and all that. The next slide. So this is the one, it's a simple, beautiful unit, and yes, it's not large, and it's very easy to carry and can put in your purse or briefcase or in your pocket to take around, and on the go you can do all that treatment. The next slide. And the blue unit, that's when I designed this, I'm trying to figure out the best color for it, and since I have multiple cold lasers units and a lot of them come in this color, so I asked for this cobalt blue color. The next. So this is the specification of the two devices. So you can see they're very lightweight. The silver one is a 7.4 ounce, and the blue, because it's an aluminum body, it's only about 4 ounce. So very lightweight. And so the energy output, okay, so it's a little difficult to get this unit to be able to do the timer, have different timers. So I just have one timer that built in, and currently is 5 minute timer. So if you don't need a 5 minutes, just want a little biostimulation effect, you can stop it at 2 minutes or 3 minutes and start feeling a little tingling or warmth. That's adequate energy that's already provided to your body. That will be good time to just change the location, change the treatment site, move on to the other part of your body that needs treatment. And it is a FDA approved the unit, and it's a under 500 milliwatts. Of course, that's a 3B according to NC classification. Let's go to the next slide, please. So we already learned so much from the 3 great teachers we have. So we know the oral application can be used on our daily dental practice, and of course for the patients, their needs are a little different, and I like to dispense it through our office because I can be there and the staff can be there to show them how to use it and specifically why they need it, and if they have other areas need a treatment, we also will review that, teach them how to use it. But it's very popular, of course, for the canker sore, and of course very popular and very needed for all the surgical procedures that we do, and like implant placement or root canal treatment or periodontal treatment, that we will have this dispensed right there and either become part of a treatment, or you can, depend on the price range that the procedure that you providing to the patient, now we'll judge that accordingly. Okay, the next slide. So what I'd like to share is what I do in the office. I feel that's actually generate good revenue is the business model. I call PBNT at home. It is that's wonderful, not just by directly dispensing this unit, your patient appreciate your care, because they can carry the care to their house, continue with the treatment, and they know they will have better treatment outcome. They will feel less discomfortable right after the treatment, and the swelling can go down or no swelling at all. So that is the, but actually what I would suggest on the price, I will talk about shortly. But it is a great return of the investment. It's not talking about how much you're charging it and how much you paid off to, you can charge to the patient. But it is the gesture, the concern, your care that they feel, and that give you incredible return. So return of investment comes in many ways that you depend on how you define it. But if you like to look at a number, it's a great number. I don't find any other business model can come with that type of a return. And if you're not interested to have any inventory, that's fine. We also offer a great affiliate program, and that it's just refer your patient to or your friend. This is such a device that will be available for you, and to continue your treatment, or will be great to minimize the inflammation that you suffer from and all that. And next slide. So this is a two ways to look at it with the two different devices. We have the PBM Lite and PBM Lite Plus. So the price range, yes, at this time, if we're talking about just the sample size, the silver units under $100, that just then if it's a blue unit, it's $139. And of course, the if we come to what's on the manufacturer retail price suggested, that will be like 180. Okay, so if you just have one unit, you pay like $100 out and you sell for 180. that's a great return. Yes, but in the introduction, I will provide you to try that out with the intro sample price. If you want to buy multiple units, that if you would come in with 5 packs or the 10 in 1 pack. So the price range, you can see it drops. So this price is a ridiculous low compared to a laser unit, but you will know the LED light, if it's the right wavelength, will provide similar biological benefit like a laser as well. And let's go to the next slide. So after all this, quick question is, can we build the insurance? I just put some of the dental procedure code that might be useful, you see applicable, and you can use this included in the price. And next slide. And if it's we can also build medical code. So that will be the code to use. And the condition that will apply to different type of condition, that like inflammation of different parts of the body and all that, you can be used as well to enter that for your medical claim. Next slide, please. So this is the last slide of the whole presentation. I will do some demonstration after this. And so I will say, please check out the websites. I have 2 websites. Normal website to purchase for consumer, all that will be the OQ.shop. OQ means oral IQ. So just abbreviate as OQ. So the OQ.shop. If it's a professional like all of you wants to get into dispensing the unit directly or get the special promo price, and please visit our pbntpro.com. I think that's a good name. It's easy to remember, pbntpro.com.
Dr. Sun, yes. Remind you, there is a link at the top of the screen, everyone. It will take you right to PBMT Pro as well. So we'll leave that up. Sorry to interrupt. I just wanted to make sure they saw that.
Thank you. And some of the procedure I did, I recorded, and so you can watch on the YouTube, Oral IQ LLC. That's our channel.
A lot of symptom discomfort from skeletal muscular system, which is very easy to manage with red light therapy. Diagnosis is always number 1. So we need to find out what causes a TMJ symptom, and looking at a full comprehensive examination. And then, of course, palpation. We can do palpation and find out more of the tender points, like where is it from masseter muscle or lateral thoracoid muscle, or we can check on temporalis or the insertion on the coronoid process of the mandible. So all this we can figure it out, and then we also incorporate with meridian point. So like the 3 points in front of the ear, it's very easy to locate on the top and the middle and lower portion. That will be a TB21 and SI19, GB2, and or ST stomach 6 and 5. So there's a lot of points, even along the cheekbones. Much easier, just use and map the quadrilateral shape, which is similar to the shape of your masseter muscles. So use this area and as a mapping technique, and then you can cover all the points you need to do, and remember where the palpation, you know where the point area you need to spend more time. And when you're treating TMJ, also sometimes have the open mouth, you can get into the energy, can get into deeper area. So you turn on the light, and remember this is your manufacturer, how much the energy output, and we also know the dosage, what we need to do. Maybe pain management, you want to go to 8 joule per square centimeters. So mapping technique is very easy. You just follow through this and go slowly. And the deeper penetration, you want a deeper penetration, for example, temporalis here, but you want to treat the insertion, the coronoid process, you want to aiming a little bit, pressing against the skin. So allow the light to go through deeper layer. So this will be the technique, a mapping technique.